I'm Jonathan.
I'm Adrian.
I'm Ian.
I'm Olivia, and this is our final talk on the chemistry of fentanyl. In 2022, the CDC reported 32,382 people dead from fentanyl-related incidents. The synthesized opioid is fatal in incredibly small doses, and usage has skyrocketed in recent years. The American Psychiatric Association says that opioids are natural, semi-synthetic, or synthetic chemicals that interact with opioid receptors in the brain and body to reduce our perception of pain. To put the dangers of fentanyl into perspective, scientists at the Drug Enforcement Agency called it 50 to 100 times more potent than morphine. Fentanyl is flammable and not very acidic. It is extremely toxic, even in small doses. Fentanyl is a white, odorless, and tasteless powder, which makes it very hard to identify. Thousands of people every year overdose on fentanyl after accidentally ingesting it thinking they were taking a different drug. Fentanyl's melting point is 87.5 degrees Celsius, and its boiling point is 465.556 degrees Celsius. Fentanyl's coloring ranges from off brown to white, and oftentimes if fentanyl is mixed into another mixture, it will change the coloring to off brown. This makes it easier to identify if fentanyl has been added to a pill or to see if the medication has been tampered with. Fentanyl is composed of carbon-22, hydrogen-28, nitrogen-2, and oxygen-1, and it contains several functional groups built around a piperidine ring. As you can see in the Lewis structures and the Vesper drawings we made, a fentanyl molecule has a long carbon chain with several different rings.
A piperidine ring is the main structure in fentanyl, and it's also the key structure found in most pharmaceutical drugs. Piperidine rings have 5 methylene groups, which is 1 carbon bonded to 3 hydrogens and 1 amine group. Amine groups are weak bases with a bitter taste, and their structure contains a nitrogen atom. Fentanyl also has 2 benzyne rings, which form a circle of alternating carbon single and double bonds. These rings are called aromatic rings. Benzene rings are very common in pharmaceuticals as well. The third structure that makes up fentanyl is amide, which is composed of a carbon, oxygen, and nitrogen atom, and is also found in medications. These structures all create a fentanyl molecule, which has several different isomers as well. Isomers, which are molecules with the same molecular formulas but with different atomic arrangements, are key components of understanding how fentanyl truly works. The risks of using fentanyl can increase or decrease depending on its isomers. If the structure of fentanyl alters, such as if the carbon chain length changes, the potency of fentanyl can rise or fall. This leads to complications with the dosage, and these complications can lead to a fatal overdose when isomers react with the body's opioid receptors. Opioid receptors are the proteins that cover cell membranes and act as communicators between the cell and opioids. And opioids are pain relievers, which can also be highly addictive. Understanding the structure of fentanyl makes it easier to avoid an overdose.
When fentanyl enters the bloodstream or the mucous membranes of the nose, mouth, digestive system, or respiratory tract, it drastically reacts with the chemicals in the body. Fentanyl reacts with the opioid receptors in the brain and body almost too well because it's so potent in small doses, which leads to a higher rate of overdosing. Fentanyl is classified as a covalent compound. It is an ionic compound because there are only nonmetals involved in the production of fentanyl. And in ionic compounds, oppositely charged ions and the attraction between them is what forms an ionic bond. Fentanyl is mainly a covalent compound, which means that it was formed when 2 atoms share electrons. The atoms are attracted to each other, and the goal of sharing electrons is to fill the valence shell with a stable octet. The hydrogens in the fentanyl bond with the body's opioid receptors because the fentanyl has a peptide ring. The charges on the fentanyl molecule cause it to naturally connect to the body's opioid receptors, and the opioid receptors stop sending pain signals, which leads to a fentanyl overdose.
To demonstrate the potency of fentanyl, we solved for the molar mass of a fatal fentanyl dose, which we found through the DEA website to be 2 milligrams. This is the amount pictured in the tip of the pencil here. So, to solve for the molar mass of fentanyl, we used the mass given by the DEA, 2 milligrams, and divided that by fentanyl's molar mass, which we calculated and added up to be 336.86 grams per mole. We calculated that 2 milligrams of fentanyl is the same as 5.96 times 10 to the negative 6 moles of fentanyl. This illustrates just how a microscopic dose of fentanyl can be so fatal and why so many overdoses happen accidentally. So, when people need a medical fentanyl dose for pain relief, they're given a solution of fentanyl citrate, which is a more neutral form of fentanyl. A neutral solution is given because if it is too basic, it won't be soluble in water, which means it cannot be given as an injection. Fentanyl's imine group makes it a weak base, and when paired with a weak acid like citric acid, this forms a salt. The forming of a salt makes fentanyl more soluble in water, and then it is easier to inject the solution into the bloodstream. If the fentanyl solution is too basic, so anywhere above a pH of 7, it will irritate human slightly acidic tissue and blood. Well, we've talked about a lot of the dangers of fentanyl. Research has been done to produce a solution to counteract a fentanyl overdose. Naloxone, also sold as Narcan, is effective against a fentanyl overdose because it binds to the body's opioid receptors better than fentanyl does, making it harder for the drug to take effect. This prevents fentanyl from reacting with the opioid receptors, which stops an overdose altogether. As a harm reduction tool, fentanyl test strips are used to detect the presence of fentanyl, like substances called analogs, in drugs, urine, or other substances. The strips contain antibodies which are designed to bind specifically to fentanyl molecules. Antibodies are proteins produced in response to and counteracting a specific antigen, which are foreign bodies. When the strip is introduced to a solution with fentanyl and water, the solution is pulled through the strip lined with antibodies, and if fentanyl or fentanyl-like substances, the analogs, are detected, there will be a visible indication, usually a line. It is a cost-effective way to prevent accidental tainting of drugs. For example, marijuana sprayed with fentanyl.
To review some of what we discussed, we talked about the functional groups that make up fentanyl molecules and the purpose that they serve, the isomers inside the fentanyl and how they interact with the opioid receptors, covalent bonding with opioid receptors, and the role molar mass plays in fentanyl dosage. We hope after hearing this TED Talk, you're more aware of the dangers of fentanyl, the chemical components that make it so deadly, and how you can prevent a fentanyl overdose. Thank you for listening.
Okay.